We're here to open a new chapter in cancer care in Northern Virginia and the entire Washington, D.C. region.
The vision of the Inova Schar Cancer Center, since it was designed and built, was to have all the care in one place.
You can tell it was constructed with a lot of attention to detail, and it's very patient-centered.
I hear patients say all the time, when I walked into the building, I felt better.
It's not just a building. You know, you are making something that's going to make a difference.
We are a part of the community, and what we're building is also serving our families.
What we have created here at the Inova Schar Cancer Institute is truly the gold standard.
It's the most impressive building I've ever been a part of.
We couldn't have asked for a better environment, a more innovative environment than we have here at Inova Schar, thanks to Clark and our other partners.
Securing the ExxonMobil campus provides Inova with a location for the Inova Center for Personalized Health.
The campus before belonged to ExxonMobil. It was dark and dreary.
We called it the Darth Vader. It was really dark, gray, gloomy, everything you don't want in a healthcare facility.
The challenge with that was, how do we take a office building and convert it into a cancer center?
On that campus, they had towers, and we really curved off and rounded them and really brought it out. So we allowed the lighting to come through and kind of bring in the nature into the space.
It is a lot of work to do selective demolition to fix something. But again, it was, we want to get this brighter. We don't want less of this dark granite. We want to open up where the atrium is.
Bringing in the natural environment we have on this campus, the trees, the light, and it's proven to be highly successful in terms of patient satisfaction, patient care, and frankly our growth in patients coming here for their treatment.
What was really unique about this cancer center was we built a proton therapy facility.
What separates proton therapy from other forms of radiation therapy is that it has a stopping power, so that a critical structure that might be behind a tumor would get absolutely no dose at all.
The main piece of equipment in proton therapy is a cyclotron. It's able to spin the cells so fast that it separates the protons from the rest of the atom. It's not quite a nuclear reaction, but it produces a lot of radiation. So in order to keep the radiation isolated, we use mainly concrete thickness.
You know, some of these walls are 9, 10, 12, 14 feet thick.
We had about 10,000 cubic yards of concrete just for the proton center.
It is a massive space, but it doesn't feel overwhelming from a patient's perspective.
The design allowed for natural light to come in, which is unheard of at most proton therapy or radiation therapy departments.
The ability to make it very patient-friendly while still having this massive technical space right behind all of that is what separates this building from a lot of other places where I've worked.
Welcome to the last quarterly Insight of 2018. We are here at this remarkable Inova campus in Fairfax, Virginia, and with me is...
In 2018, we were broadcasting a company insight from the radiology department.
We're standing in the CyberKnife vault in the Proton Clinic space.
I remember getting a tour and the team talk about the project and the impact it was going to have.
Our message from the beginning of the project has always been building towards a cure.
We always take that mindset into account when we're looking at quality, making sure we turn over the best possible building.
Fast forward to summer of 2021, and I was diagnosed with breast cancer. I was waiting for a radiation appointment. It dawned on me it was the exact same spot that we had been sitting in 2018, but now here it was. I was getting to experience the well thought out design, the level of calmness and comfort. I was immensely proud at that moment to be experiencing that.
My mother was treated there, so it does speak wonders when the thing that you turn over ultimately, treats our friends and families.
Over 7 years ago, the Inova board and senior leaders decided to build a place for us to care for our cancer patients of Northern Virginia, and that day is now finally here.
The design process and the construction process was very collaborative.
One of the things I have really loved about Clark is their willingness to listen.
Once you see patient one come in the door, get their treatment, it really comes to the heart of why we build in healthcare.
You're not just showing up and putting in work and leaving. You're building what matters.
We couldn't be more proud as an organization. I couldn't be more proud personally.
What we tried to develop here was an environment that was warm, welcoming, supportive, and comprehensive. And that's what we've been able to do here at Inova Schar with Clark's great assistance.